Pretty cool. Oh,
We are now.
Are we live?
Yeah, we're live.
Perfect. Good morning, everybody.
Good morning, everyone, and welcome. It is Wednesday, January 21st. It is 9:02. We are in the Center hearing room at 555 Court Street Northeast in Salem. We always start with the Pledge of Allegiance, so if you would please join me.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I have David Beam signed up for public comment. David, if you want to come over here and introduce yourself for the record.
Thank you, County Commissioners. Thank you for having me here today. I was thinking about fund for the fire stations and mental health services for Marion County for funding every four-year term. I think we need funding for that emergency for disabilities and the families don't have any services after 5 o'clock. So that's what I'm asking for the next session.
Okay, thank you.
Thank you.
Thanks for being
having me here.
Happy New Year.
Try to stay warm, David.
good to see
I
you
will.
there.
Thank you.
Okay, next up we have our consent agenda. Whose turn is it this morning?
Oh, it's his.
Oh, it's Commissioner
He was the chair-
Cameron's.
He chaired for you last week, so I did it.
Yeah,
Okay.
so, Mr. Chair, I'm honored to move the consent calendar this morning. First item is under Public Works to approve a private development agreement with Public Road Improvements with Capital Football Club to establish the terms, conditions, and timelines for the construction of an eastbound left turn lane on State Street in Salem, Oregon. Second item under Tax Office, approve orders for a property tax refund for the following tax accounts: Cartwright Apartments LLC, account 585520 in the amount of $22,638.81, and Return Polymers Inc., account 510656 in the amount of $25,990.66. The last item under Legal Counsel, approve withdrawal of ordinance number 1485, approving case number CUCP 24-038 TLM Holdings LLC for reconsideration of findings per Legal Counsel recommendation.
I second the motion.
We have a motion and a second. Is there any further discussion? Seeing none, all those in favor signify by saying aye.
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 Aye, the motion passes. Okay, next up we have, wow, we got a big crew here. Katrina Griffith, Debbie Wells, Chief Gerboth, oh, you got a big long name, Chief Gerboth. It says David Gerboth, Fire Chief, City of Salem Fire Department. Oh, you got a big introduction there. Please come on down and tell us about this new program that we just started.
Good morning. I'll get started. My name is Katrina Griffith. I'm the Deputy Director for Marion County Health and Human Services. And we're here today seeking approval of a memorandum of understanding with Salem Fire to implement the Rapid Engagement Assessment in Community Health, or REACH program. I'll turn it over to Debbie and Chief Gerboth in just a minute, but I just wanted to highlight how great this partnership has been working so far, and we are just getting started. Our first meeting was June 24th of 2025. It's only been 7 months, and 2 units of local government have come together so quickly to implement this program. So it's really exciting, and I'll turn it over to them to tell you more about the program.
Good morning, Commissioners. Debbie Wells, Division Director of our Behavioral Health Crisis Services with Marion County. As Katrina said, we're here to present the REACH Team Pilot Project MOU between Marion County Health and Human Services and the Salem Fire Department. The REACH Team, which stands for Rapid Engagement Assessment Community Health, is a pilot project designed to strengthen the county's response to behavioral health crises, substance use-related concerns in individuals who frequently utilize emergency services. The model pairs a qualified mental health associate with an EMT and a paramedic. Across Marion County, first responders are increasingly dispatched to situations where the primary need is behavioral health or substance use support rather than emergency medical transport or law enforcement intervention. These calls often result in repeated 911 utilization, emergency department congestion, and missed opportunities to connect individuals to appropriate and ongoing services and care. The REACH team is a mobile community-based response unit composed of 1 paramedic, 1 EMT, 1 qualified mental health associate. The team responds to selected 911 calls with identified outreach needs. Services include on-scene medical behavioral health assessment, crisis de-escalation, and linkage to community resources such as crisis services, substance use treatment, including medication-assisted treatment, housing resources, and outpatient behavioral health care. The MOU before you today formalizes the collaboration between Marion County Health and Human Services and the Salem Fire Department for operation of this pilot program. Both agencies share responsibility for program evaluation. Measures include reductions in unnecessary emergency department utilization, decreases in repeat 911 calls, and successful connections to care. Approval of the MOU authorizes a 6-month intergovernmental partnership implementation of an evidence-informed alternative crisis response model and continued development of coordinated solutions that improve community outcomes while using public resources more effectively. Chief Cabell?
Well, it's always great to follow Debbie because she said it all. So there's really nothing I can add to that other than I just want to really extend my appreciation for collaboration and to start in June and then start meeting with somebody from another state who hadn't even been here a year yet and build the trust that we've built to this point is truly exceptional. I think this is really the best of government. You have 2 entities coming together for the entire region and not just for one particular jurisdiction. So I'm excited about it. I'm excited about the improved service to our entire community. I think it's going to be a model not just for this region, but for the state.
So credit to you, Chief, for bringing this forward. And you might not have read between the delight that Katrina was expressing over there, but our experience working with the City of Salem has not always been this delightful. And so you have a lot of credit there. Your credit to your city and really have shown how to collaborate with other government entities, and I've heard that from not just us, but other entities in the region, state partners, that sort of thing, that you've really taken the helm and done a great job there. So thank you for doing that, and yeah, this is too late to say this, but welcome to our community. We're happy to have you. I always say to people, this is not a place where you have to come from a certain family or be a certain religion or race or ethnicity to be a part of this community. But you do have to contribute. This is a community where I think a lot of folks say, hey, are you giving or are you taking? Are you contributing to this community? And in your short time here, you've given a lot. So I really admire you for that, and thank you for being a part of this community.
Well, thank you very much. And I can't say enough about the Health and Human Resources staff that once I got to know them, exceptional, dedicated individuals, and just look forward to keep working together.
Great. Commissioners?
Yeah, so I think it was great that we had the press conference yesterday. Thanks for putting that together. It got some good news coverage last night. I think it's important that we talk a little bit about what this team's really going to do. Yesterday I heard a city councilor refer to Cahoots and her dreams of having Cahoots come to this community, and it's really important for me in this commission to recognize that this isn't Cahoots. And it's not even at all like Cahoots, which is a Eugene-based model that is no longer. So you kind of glazed through, Debbie, like overarching what it's going to do, but between the two of you, can you please just provide a clear discussion as to what it looks like on the ground and what the intention is? I know about it, but I've also been watching some of the social media conversation, and there's definitely a little bit of confusion and some frustration. And I'm going to let you get to the explanation, but I'll just say that just acknowledging the public's awareness that Oregon has thrown a substantial amount of money at the behavioral health crisis and accomplished little to no success. And there's reasons for that. All reasons that here in Marion County we don't support. You know, you mentioned, Debbie, this being a metric-driven purpose concept. You talked about it yesterday during the press conference, Chief, where you have measurements and goals and what that looks like. At some point, the public really needs to, I think, wrap their arms around that and understand it so they can accept it. This is just a pilot. I think it will be very successful because of the time, the 7 months that you described has been spent behind, closed doors, really designing and looking at data-driven needs. But this isn't a response to homelessness. This is a response to behavioral health, and there's a lot of people who are experiencing mental health crisis that are not homeless, that are literally on the streets, that have a house somewhere, that interact with the crisis center, that have kind of this ebb and flow, that end up in the ER. So there's like real reasons besides the fact that homelessness is a crisis in Oregon that we decided to work with the city to come together. Yes, we need lots of other services too, but this is a little bit different than what I think the description I heard yesterday and came out a bit in the media last night. And I want to make sure we get it right. So that way, when we accomplish this pilot, the public is set up for success and not failure based on some random interpretation of what they thought we were going to do. So what are we going to be doing?
Well, let me start with a couple items. There is other programs to reference, and I think one of the differences is that we, as public providers, do not have oversight or accountability over nonprofits, NGOs that are doing good work in the community, but we don't have oversight over that. One of the differences here is there's going to be relentless oversight and accountability. We answer to the county commissioner, we answer to the city council, and so those metrics are going to be evaluated and scrutinized where maybe they haven't been in other programs. And so that level of accountability, I think, is incredibly important when we're expending public funds. I have seen comments, well, why would we do this at all? Why would the fire department engage with this? The fact is, we go to the calls no matter what. The fire department has become the ultimate social safety net, whether those same nonprofits and NGOs, when medical needs become too acute for them to deal with, it's a 911 call, the fire department responds. When mental health crisis becomes too extreme to deal with, it's a 911 call, and either fire or police or both respond. And so to finally provide those services, the right resources at the right time at the right place. Right now, the only tool that we have is sending a fire engine. That's not the right tool for everyone. And then the only recourse we have for treatment is to bring somebody to the emergency room, which we also know is not the right tool. We have one of the busiest emergency rooms on the West Coast. Constantly inundating that with more patients that aren't going to be treated effectively is not the best course of action. So we're looking at many different metrics. One is we're pairing advanced life support with a mental health associate. That is unique in that we can respond to 911 calls, we can respond to the overdoses, we can respond to these medical conditions. At the time, we can also help connect with services. Just as an example, right now, we go to a large number of overdose calls. The only recourse we have is to provide one drug. It's called Narcan. It wakes somebody up. Oftentimes, we arrive, they're in respiratory arrest on the verge of death. We provide Narcan. 30 seconds later, they're out of overdose. They're in withdrawal, and they've eloped and ran away. We've done nothing to help a curative manner. We are now doing medical assisted treatment where we can provide not only a drug that will stop the overdose, but stop the withdrawal, where we can actually have a conversation with somebody, try to get them into treatment. So that's certainly one aspect of that. The relief, City of Salem Fire Department, we're a operationally saturated organization. We just had our highest call volume ever, 9% increase year over year. It's not sustainable. And so is there a way that we can release some of our heavy equipment and those 911 calls so that we're available for the more larger and more acute calls throughout the organization? And then our reduction of our emergency room inundation we talked about. There's now other resources that we're combining with that we can transport other to the emergency room, which is honestly monumental. The county's done a great job setting up the new mental health crisis center that now has emergent beds that we can bring to for appropriate treatment. We're working with some of our other providers, whether it's housing, immediate housing, or rehabilitation services.
Thank you. Want to add anything?
I don't think there's much to add. I think as Chief Gerboth said, it's really about the response. It's the right response at the right time.
Yeah.
And so much of what we're looking at doing is to reduce the burdens on our other systems. And so that's really where we're focusing most of our attention.
And the data on those systems is available. I think that's what I think is important when you talk about data. Like, you've looked at all the data. You've talked to the emergency room. You've looked in the CAD. You can see where people are going in the system, and we also hear the complaints. It's not, maybe the public isn't hearing it, but when we're moving around in our system to try to find stabilization and success, we hear that relief valves are necessary for a lot of these service systems that are not adequately resourced and or prepared or just appropriate, frankly. Yes, the ER is where you should go if you have an emergency, hands down, but typically it's a medical emergency, not necessarily an addiction emergency. And what they do is reactive. It's not prolonged, it's not proactive, it doesn't sustain because it's a fast system. This, to me, is going to do the initial engagement, build the connection, and then enter them into a system of care that's really robust, while super under-resourced also. There's different pathways, and this is going to be great. I'm excited because I understand the data, and I think we need to keep talking about that. We have check-ins. I'm sure you know about that, Chief, but we've asked the health department to come to the commission at various touch points. I don't remember what they are exactly, to give us kind of as we enter into this, not just a beginning and ending, so that way if we need to pivot, this partnership can pivot. And pivoting means we want it to be successful. So I'm really looking forward to it overall, but I really think that we have to do a good job of really educating the public on what we're doing on all of our systems so they can be a part of and accept or not accept if they choose.
Well said. Mr. Cameron?
Yeah, thank you, Mr. Chair, and Commissioner Bethel, I think you said it. I just want to, how do I want to say this? Under promise here, because this is a pilot. It is one team, which will be probably working 40 hours a week. It's not a 24-hour, 7 days a week program yet. And the data is really important so that we can show that it does help people and that there is a reason to expand it in the future if that's what the data shows. But I just want to make sure that because I heard it on the radio this morning, saw it in news last night, good job promoting the program, but I also want people to make sure that they understand this is one team, Chief and Debbie, that people are going to say, hey, I thought that team was out there when we called. And so making sure that people understand that it's one team that's out there 40 hours a week, and I'm sure you'll be scheduling them where the hot spots are as far as time goes and days go. So I want to thank everybody for the cooperation, the collaboration that we put together. And I remember the first meeting that I was in on this, and Commissioner Bethel said, we'll buy you the SUV, right?
I brought it up yesterday, too.
And he says, we got the SUV. Yeah, so thank you very much.
Awesome.
Yeah. Okay, are you ready for a motion?
I am ready.
All right, Mr. Chair, I move to approve the memorandum of understanding to establish a collaborative partnership between Marion County Health and Human Services and the City of Salem Fire Department to implement and support the Rapid Engagement Assessment and Community Health Team Pilot Program known as REACH.
I'll second the motion.
We have a motion and a second. Is there any further discussion?
Just want to say thank you.
All
Thank you for
right.
your support.
All those in favor signify by saying aye.
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 Aye, the motion passes. Thank you. Thank you, Chief, for being here. Thank you, Debbie. Thank you, Katrina. You're not leaving. Okay, next up, we're going to consider approval of an order to revise the bylaws excuse me, for the Marion County Ambulance Service Area Advisory Committee. Huh, you're not leaving either.
No, sir.
Oh, good. You can stay all day if you like.
All right, good morning. Again, I'm Katrina Griffith, the Deputy Health and Human Services Director, and I am also appointed as the Ambulance Service Area Administrator for Marion County. We are here seeking approval for the Ambulance Service Area Committee bylaws. The committee is comprised of members from all 10 of our ASA regions and 1 member from Willamette Valley Communications Center. The purpose of the Ambulance Service Area Committee is to serve as an advisory group to the Marion County Board of Commissioners and the ASA Administrator to provide oversight, relationship building among stakeholders, and recommend system improvements. They weigh in on the development of the ASA plan, which regulates emergency and non-emergency ambulance services every 5 years. The goal for the bylaws revision was to align the language with county ordinance and the ASA plan and county policy around volunteer recruitment and filling vacant positions. The major change I want to highlight is the officer appointments for chair and vice chair. They would move from 1 year to a 2-year appointment. This seemed to make the most sense since we meet quarterly, and we felt this move would allow for greater continuity in leadership and just some minor language cleanup, as it has been 3 years since our last bylaws revision.
Great, thank you. Commissioner Cameron, do you have any questions?
No,
Commissioner Bethel?
Nope.
appreciate all the work that's done on this really important group, so thank you. It's
Thank
not
you.
easy, yeah. Mr. Chair. Mr. Chair, I'll move that we approve an order to revise the bylaws for the Marion County Ambulance Service Area Advisory Committee.
I'll second the
We have a
motion.
motion and a second. Is there any further discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Aye, the motion passes. Okay, Katrina, now we're gonna do some appointments.
Yes, and I also have someone working with me now on ASA plan, was John Kubisak, and so he will be presenting the appointments if that's okay.
Welcome.
Thank you. Good morning. My name is John Kubisak. I'm the Community Relations Coordinator at Health and Human Services. And one of my tasks, as Katrina said, is to support the Ambulance Service Area Advisory Committee. So I have 2 matters of appointment for your consideration. First, 4 committee member appointments, and then the officers. So first, for the appointments, we are seeking the renewal of terms for 3 existing members: Sherry Bensema from Lions Ambulance, Frank Ermentrout from Polk County Fire, and Danny Freitag from Saniam Ambulance. And the 4th is someone who you've already met, Salem Fire Chief David Gerboth. He's a new appointment to the committee, replacing the previous Salem Fire representative in Kyle Amsbury. So if approved, all 4 of them would serve a 3-year term on the advisory committee through January 31st, 2029. Chief, I don't know if you want to introduce yourself any further, or?
Sure, I'll just, Dave Gerboth, Fire Chief of the City of Salem. Thank you. It really is an honor to be able to serve the region. It is mentioned that I take the place of Chief Amsbury. Chief Amsbury is retiring. He's done an exceptional job of not only representing the ASA, but also helping create what is, depending on the day, either the first or second largest public ambulance service in the state of Oregon that is serving this community in an exceptional manner. And so I'm honored to do it. I think the word of the day is collaboration. Working with 10 different members, I think we get something from everyone. Some of the things that we're doing locally between Kaiser and Marion County, for the first time ever, we've brought all of our medical directors together, and we're going to have the same protocols between all of our organizations. So we're doing mutual aid. There's no confusion. It seems like an easy thing, but we're advancing considerably. So I'm looking forward to not only benefiting the city of Salem, certainly, but the region as a whole.
That's great. It's a pretty good group, isn't it? The ASA group?
It is, yeah. Seems like a very good spirit among the committee and very collaborative.
Not every ASA is as collaborative.
And or historically this one. It's been a long road. Happy to be here. All right.
All right, I'm ready for motion.
Okay. Mr. Chair, I move to approve the orders appointing Sherry Bensema, Frank Ermentrout? Okay. Daniel Freitag and David Gerboth to the Marion County Ambulance Service Area Advisory Committee with terms ending January 31st, 2029, and orders appointing Brian Butler as chair and Sherry Bensema as vice chair for the ASA Advisory Committee with terms beginning January 31st, 2026 and ending January 31st, 2028.
I'll second the motion.
We have a motion and a second. Is there any further discussion? Just a comment. I see that term ending 2029, and that means that 2030 is not around, not too far away, which is shocking to me. And my daughter the other day said, "Dad, didn't this happen in the last century? You know, the 20th century." And I was like, oh my gosh, I am so old. So, with that, is there any further discussion?
Nope.
All those in favor signify by saying aye.
Aye.
Aye. The motion passes. Thank you.
Great. Thanks. Have a good day. Nice to see you.
Okay. Next, we're going to consider approval of the software as a service agreement with i3 Logic, Inc., in the amount of $100,050 for ballot tracking software that provides real-time updates for Marion County voters retroactive to January 1st, 2026 through December 31st, 2028. Rebecca?
You just want to give them to Brenda, whatever it is you're handing out.
All right.
It's SF.
Oh,
I
yay.
was thinking of the San Francisco Giants.
Good job.
David's
You can just go ahead and introduce yourself for the record.
I'm Rebecca Sterndal. I am
Could you turn your microphone on? Nope, just the thing in front of you on
Just
the
tap
base.
it.
There you go, thanks.
Good morning. I'm Rebecca Sterndal. I am the Elections and Recording Manager in the County Clerk's Office. Good morning, Commissioners.
Good morning.
Morning.
All right, so you'll just tell us that you're here to present whatever and get into it.
I am. We have a service we provide voters. Most of the counties in the state use it, called Ballot Tracks. It is a service where voters sign up for it, and then they can receive texts or emails letting them know when their ballot has been mailed, when we have received it back. If there is any issue with their signature or they forgot to sign, they can know about it before we send out our letters. It's a very useful service that our voters seem to love. So we would ask that you renew this contract that we have with i3Logics for the next 3 years, and we're planning for 3 full countywide elections per year for the $150,000 for that contract.
I appreciate that it's now an Oregon area code that calls me instead of, at one point, a couple years ago, it was some out-of-state area codes. And
Right.
I would ignore the calls, of course, because I thought it was a scam. So.
Because it's spam. Do you want to tell people how they can, like, what's the process to get involved in this if they don't know anything about it?
The process is, on our website, we have links to go to Ballot Tracks and sign up for it. It's a very quick and easy sign-up process. And then the Secretary of State's site as well has links to it, and we put a QR code in our voters pamphlets to allow for that.
Oh, I didn't know that. The QR code I did not know about. I mean, I already signed up for it, so it's not like I look for it, but that's good to know
Yeah.
that it's in the QR code.
So,
Very good.
Is there a number I can call if I don't have, I mean,
To sign up, like if you don't
Yeah.
have the digital option. Can they sign
Can
up
I-
over the phone with
or
you
can
all?
I come to the clerk's office and do it, or?
it is not something you sign up in our office. It's not, we don't manage that.
But
We
is
pro-
there a computer there that I can use to, if I don't have a computer
We do have public terminals. We can
Right.
make that happen in our office.
on the
Yeah.
second floor here, you
Yeah.
can come in and sign up for it?
Correct.
Good, that's another option. Good. Yeah, I've been using it for years, and I think I've shared that, I remember, I'm gonna date myself here, but it was, election of 2006, almost, 20 years ago. I remember it was the first time it was a primary. My first time my name was on the ballot. I voted for myself. And then at that time I was extremely busy and I had a stack of mail, and I got to the stack of mail and I had a letter from the clerk's office that said basically you need to come in because you forgot to sign your ballot. So it was way past the election, right? So I didn't even get to vote for myself. That-
And you won anyway.
Yeah, by one vote. Yeah, no, yeah, I won anyways, because I don't even know that I had a primary, right?
Oh,
It was,
there
it
you
was
go.
one, I mean, I don't think I had an opponent, but my point being is, if I would have had this then, which I do now, if I would have signed up for this, I would have got a text message that said, we've got your ballot, but what would it say?
That is correct. It would say that there was possible concerns with your signature. Or that you had forgotten to sign.
Right.
And we do every election have people come in to the office to take care of their signature issue or to
Yeah.
provide their signature before we even mail their letter.
Yeah.
Right, because they
Because
get
they-
the text.
Text
Because they
comes,
get the
text
call, yeah.
comes sooner than the mail,
Yeah,
right.
that
So-
happened to me in 2020 when
Yeah.
I was running for this office. I had to go in and hear
your
my
signature.
signature.
Yeah.
I did get a letter though, because at the time I was not signed up, but you all told me up there, you know.
Yeah, that's my point. You check your mail better than I did 20 years ago. It wouldn't happen to me today, but it did 20 years ago. So thank you for this service. It's really important. And I really encourage people when I tell them about it, so.
It's a nominal
you.
fee too, I think, in order to make sure people are aware. And it gives you an update, like, this is the same system that gives me your ballot's been received, your ballot's been
Correct.
processed, your whatever.
Correct.
That's, I watch for that,
Yeah.
yeah.
All right.
Awesome.
You ready for a motion?
I'm ready for motion.
Okay, Mr. Chair, I will move that we approve software as a service agreement with whatever that is, i3 Logics, Inc., in the amount of $100,050 for ballot tracking software to provide real-time updates for Marion County voters retroactive to January 1st, 2026 through December 31st, 2028.
I'll second the motion.
We have a motion and a second. Is there any further discussion? Seeing none, all those in favor signify by saying aye.
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 Aye, the motion passes.
Thank you.
Nice to see you. Thank you for the sheet.
You're welcome.
Okay, we don't have anything else on the agenda, commissioners. Do you have anything you would like to share?
Well, the short session's coming. The short legislative session starts on Groundhog Day, which is just a couple of weeks from now. And there's some interesting concepts moving through. Yesterday, the Senate Majority Office sent out their short session priorities, and it's all about taxes. There's like 19 bullet points.
Wow.
And they essentially, they use the words ensuring access to services, and then they attack the federal administration for Medicaid, SNAP, all different types of health care, just a myriad of things. So it is clear that they are going to try to raise taxes statewide. My understanding is in 3 formats. They're going to try to raise the income tax. They are looking at forcing a sales tax, and then they're looking at a certain type of a corporate business tax, all to generate significant revenue to make up the federal shortfall that they're projecting over the next 2, 4, and I guess 6 years. I was disturbed considerably when I read that press release and then went further into the details. I don't understand how they could be so tone deaf as an entity, after everything we just went through with the ODOT tax repeal and a substantial number of Oregonians showing up during the 2025 long session to say no.
Yeah.
And now they're going to cram it down our throats in a short period of time with very short notice, with the inability for the public to be present. Just disgusts me, if I'm being totally honest. I think it's just gross.
Well, I've always said the only good thing about the short session is that it's short.
Yeah, well, they're going to try to do a lot of harm. There's a couple of good things coming forward through it. Lots of conversations around how to make certain systems more viable or healthy. There's not enough time to have those real conversations, but I appreciate that there are legislators in the building who acknowledge that the state system of care is failing and it's causing a burden on local governments that deliver those systems. And of course, we have some legislation that we'll be supporting. Representative Anderson and Representative Mannix are carrying a bill to help with the civil commitment process, which is really important. Just one more step in the process of helping people become healthy and stable in our community. I'm really hoping that Representative Kropf, who oversees the committee in the House, will acknowledge that piece of legislation and really actually actively move it forward. We see people every day, but I've talked in here and other places about cases in our community that I've actively been a part of that are devastating, and families are being destroyed and the burden that they have because they can't get their family member help because that system of care is so inaccessible.
Yeah.
It's just one more thing. It's not the thing, but it's just one more thing, that bill in the right direction. So on that particular thing, I'm hopeful. On everything else, I'm a bit concerned, or I should say deeply concerned.
Yeah.
So I guess stay tuned. People need to be paying attention. Marion County is the closest county to that legislature, and testimony needs to be active and present, and hopefully we can be heard. So,
It's a good message.
yeah, thanks.
Commissioner Cameron?
Just since last week, went to the I forgot to say that I went to the Northgate Neighborhood
I heard.
Association. You did?
I did.
Oh, good.
I got an email about it and your wonderful presentation.
Great. Just talking, we talked, in fact, Fire Chief was there too, talking a little bit about this and some other things. and they had questions about the drawdown and how it would impact Marion County and the city of Salem. And still working on that from all angles to try to make sure we preserve our water quality within, and irrigation for our agriculture, all that stuff. So there's big risk involved. And then I think I shared with you, we went to the Doris Place opening.
Yeah.
It was interesting because Rob was there and he talked about Doris babysitting him when he was 3 years old, right? It was a great community event out in Staten, and just you live in a really
Right.
neat
It's a cool
community,
place.
you
Really
know.
cool place.
Even though it's a suburb of Sublimity,
Oh, brother.
it's really. I love the people out there. Every time I go out there, and of course I had previous family that farmed out in that area, Almsville, Staten area, that was kind of helped me fall in love with Marion County, just the agriculture that happened out there. And that was a time too when NORPAC was really big, and interesting the changes that we've seen. But yeah, it was great. Those are the couple things that, besides our regular stuff, that I did last week, so it was
Very
good.
cool.
Oh, and then I attended Saturday night, just the end of the snowmobile club meeting up in Detroit.
That's an important
they-
meeting.
Using that community,
Glad you were there.
they use that community center. I'm not a snowmobiler, but yeah, they always do good events, and yeah, they had big potluck, and yeah, so it's a good
Good.
week.
Very cool.
Yeah.
Lots of things happen.
Yeah.
Okay. Well, with that, we are adjourned. Thanks, everybody.